Keying here to the palate to have you take a look at when the palate, and we're talking about the palatine bone, which is right back here. When the palate goes into flexion or rises up, what happens is the palatine bone is the bone that drives the height of the palate. It is a posterior aspect of the palate that tends to go up and down. So the palate will go into the palatine bone will go into flexion extension, lifting that palate. The ability of the palate to lift will affect the vomer, which affects the entire cranial dynamics. That's why we talk about things like tongue tie, or children have trouble nursing or sucking, or difference in sucking strength. If that is difference along the palate, not only is it going to affect the way the palate grows, but it's going to affect the motion of the entire craniofacial structure, because it's going to affect the ability of the sphenoid wing to move. If it affects the ability of the greater wing of the sphenoid to move, then we're going to have a restriction in the synchondrosis, or the sphenobasal, and that'll affect the entire cranial vault. But as the palate rises up, you can see the sphenoid wing will go superior and anterior. And we also have here the ethmoid rises up and the frontal. So we're literally changing the tension throughout the entire dural meningeal system. And often and we're going to talk more about it in the class, when we evaluate the palate, the motion of the palate is going to give us a window into how the rest of the cranium is actually able to function.